Hello everyone, my name is Becky Miller and I'm presenting the CHA2DS2-VASc and HAS-BLED tools for clinicians of patients with atrial fibrillation. The CHA2DS2-VASc tool is a clinical prediction tool designed to aid clinicians in thromboprophylaxis for patients with non-valvular atrial fibrillation. As clinicians, we see many patients with atrial fibrillation. The U.S. Medicare data in 2010 reported that 9% of patients over the age of 65 are diagnosed with atrial fibrillation. For those patients of European descent, the lifetime risk of developing atrial fibrillation after 40 years of age is 26% for men and 23% for women. The American College of Cardiology and the American Heart Association treatment guidelines are based partially on the patient's CHA2DS2-VASc score. Using the CHA2DS2-VASc tool is recommended by both the American College of Cardiology and the American Heart Association. The HAS-BLED tool is used to help clinicians identify bleeding risks associated with anticoagulant therapy and is recommended to be used with the CHA2DS2-VASc tool to help clinicians in risk versus benefit treatment decisions. Here we have a flow sheet sample of the CHA2DS2-VASc and HAS-BLED tools side by side. The CHA2DS2-VASc tool looks at these different stroke risk factors and assigns a max score of 9. Which would indicate a high risk of stroke. The HAS-BLED tool looks at different bleeding risk factors, also with a max score of 9, to be used to identify risk versus benefit anticoagulant therapy for atrial fibrillation. A CHA2DS2-VASc score of 0, there's no therapy that is recommended at that point. A score of 1, they are recommending oral anticoagulation, and a score of greater than 2, they're definitely recommending oral anticoagulation. HAS-BLED score of greater than 3 indicates a high risk of patient bleeding, and if oral anticoagulation is prescribed, regular and frequent patient review is recommended. So pros to using this tool is it's quick to use. There's no need for the internet or computers if they're not available. It is recommended to be used by the American Heart Association and the American College of Cardiology. Con, it doesn't replace critical thinking or clinical decisions. There are several calculators online, although I think paper would work just fine in the clinic. But for ease of use during this presentation, I'm going to take you to mdcalc.com. We'll calculate a patient's CHA2DS2-VASc and HAS-BLED scores. So here for the CHA2DS2-VASc score, let's say we have a patient that's 70 years old and is female with hypertension and also diabetes. These are her stroke risk factors. That gives her a score of 4, which is considered moderate to high stroke risk. This patient should be prescribed anticoagulation, but before we write for that, let's check her HAS-BLED score. So we're going to say she does have uncontrolled hypertension, as well as renal disease related to her diabetes. And we said that she was 70, so she's over the age of 65. And those are her bleeding risk factors. So that gives her a score of of 3, which puts her at risk for a high risk for bleeding. So here we need to weigh the risks and benefits of treatment. With those quick tools, we can identify risks quickly. I hope you enjoyed my mashup and have maybe taken something away to use in your practice. Thank you for watching and have a great holiday.